Hello everybody, I'm Dr Mahesh Hampe. I'm the Senior Consultant at MedGenome, Bangalore. I just want to share some of the views of rare disorders in India. Though they are called rare, but they are actually not rare. The challenge we are getting is some of these tests and the disorders are even not being made aware to the common pediatricians or common physicians also. Okay, so you can consider the unawareness in the common community as well. So what I feel is though these are rare disorders, we have to make our people aware about this rare groups. The treatment part is now available to all these rare disorders. We should seek for the diagnosis, timely diagnosis, and the awareness among the people to come to the clinic and get these test disorders detected. So there are very simple tests available nowadays, which we call it as a screening, and there are tests which confirm the disorders. So since with the advancement of technologies, with new machines and new platforms being made available, these tests are now become very feasible, and at a low cost it can be detected. So we have to let the people understand that these tests are very much feasible to be done at by collection of few drops of blood. In 1960, Robert Guthrie has given a gift of filter paper collection of sample. So we can collect few drops of filter paper blood sample, and that can be subjected for biochemical analysis, enzyme studies. So with single prick of sample, we can detect so many disorders, rare disorders, and we can screen the baby out or screen the patient out for that particular disorders. Some disorders are very common in some of the families because consanguinity is very high. In those conditions, in those families, we have to screen those particular dangerous conditions in those particular risk families, like say for example sickle cell anemia. Okay, so we have to screen the babies for the homozygous sickle conditions because those are very clinically manifesting disorders. Same is the case with LSDs, same is the case with mucopolysaccharidosis. So those disorders, if they are running in the family, and sometimes we come across some unfortunate families wherein there are repeated abortions, repeated deaths in the family, but still they are not going and screening themselves or like doing the testing for the parents. Okay, so that's why repeatedly the deaths or abortions are happening. Okay, and this is really unfortunate for those families. We can cut this particular cycle of abortions and deaths in the family by doing the testing, and even during the pregnancy also, or immediately after the pregnancy also. We call, if the testing is done during the pregnancy, we call it as prenatal screening, and if the testing is done after the delivery, we call it as newborn screening. And we can have an option of carrier screening also, wherein both the parents can be screened, and then we can check the risk which is possible in that particular embryo or in the baby. Okay. So with this testing, we can avoid the future of India by testing those prevailing conditions in the family, and we can avoid them and treat them if at all they are diagnosed. And that is one of the blessings that current medicine has provided to us. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.